Question 1. What is the primary role of a registered behavior technician, RBT? A. To design behavior intervention plans. B. To supervise other behavior technicians. C. To implement behavior intervention plans under the supervision of a BCBA or BCABA. D. To diagnose developmental disabilities. Answer: C. To implement behavior intervention plans under the supervision of a BCBA or BCABA. This question is asking about the main job of an RBT. The key phrase here is primary role, which means the most important or main responsibility. While other professionals might design plans or supervise, the RBT's core job is to directly work with clients, carrying out the strategies and plans created by a supervisor, like a BCBA or BCABA. You are the one on the ground, putting the plan into action, whether it's teaching a new skill or helping someone reduce a challenging behavior. You don't design the plan yourself, and you definitely don't diagnose conditions. Think of it this way. The supervisor is the architect designing the building, and the RBT is the contractor building it according to the plans. Your main role is implementing the plan carefully and consistently. Question 2. When tracking how long a behavior lasts, you are using which type of measurement? A. Frequency. B. Duration. C. Latency. D. Interval recording. Answer: B. Duration. This question is about different ways to measure behavior, specifically focusing on how long a behavior occurs. The keyword "how long" directly points to the concept of duration. Frequency is counting how many times a behavior happens. Latency is the time between a direction and the start of the behavior, and interval recording is checking if a behavior happens within a specific time block. If you are measuring how long a tantrum lasts or how long a child engages in playing appropriately, you are measuring the duration of that behavior. Duration is simply the total time elapsed from the beginning to the end of a behavior. An easy way to remember this is that duration sounds like durable, which relates to something lasting for a period of time. Question 3. What is the term for anything that happens before a behavior occurs? A. Consequence. B. Behavior. C. Antecedent. D. Stimulus. Answer: C. Antecedent. This question is asking about the sequence of events in understanding behavior. The phrase "happens before a behavior occurs" is the main clue. In behavior analysis, we often look at the ABC sequence. Antecedent, greater than behavior, greater than consequence. The antecedent is what happens right before the behavior. The behavior is what the person does. The consequence is what happens right after the behavior. So, the antecedent is the trigger or the setting condition that is present before the behavior starts. It's like the A in the ABCs of behavior. A simple example is if the light turns green. Antecedent: you step on the gas. Behavior. Question 4. A client gets a sticker every time they put their toys away. This is an example of A. Punishment. B. Extinction. C. Reinforcement. D. Response cost. Answer: C. Reinforcement. This question describes a situation where something is given to the client after a behavior, putting toys away, and it is implied that this makes the behavior more likely to happen again in the future. Getting stickers is usually a good thing that makes you want to do that behavior again. This describes reinforcement. Punishment would make the behavior less likely. Extinction is when reinforcement is stopped for a previously reinforced behavior. Response cost is a type of punishment where something is taken away. Since the sticker is given and likely increases the toy tidying behavior, it is an example of reinforcement. Receiving something positive after a behavior makes that behavior stronger. That's reinforcement in action. Question 5. Which ethical principle emphasizes promoting the client's independence and life skills? A. Beneficence. B. Non-maleficence. C. Autonomy. D. Fidelity. Answer: C. Autonomy. This question is about ethical principles in ABA, specifically focusing on helping the client become more independent. The principle of autonomy means respecting the individual's right to make their own choices and promoting their independence. Beneficence means doing good for the client, and non-maleficence means avoiding harm. Fidelity relates to trustworthiness and keeping promises. While all are important, promoting independence and self-sufficiency is directly tied to the principle of respecting and supporting the client's autonomy, helping them gain the skills to manage their own life as much as possible. You are helping them gain control over their own environment and choices. Question 6. If you are measuring the time between the instruction, touch your nose, and the client actually touching your nose, you are measuring A. Duration, B. Frequency, C. Latency, D. Inter-response time, IRT. Answer: C. Latency. This question is asking about a specific type of measurement, the time between a cue or instruction and the start of the behavior. The phrase time between the instruction and the client actually touching their nose is the key here. Latency is defined as the time from the presentation of a stimulus, like an instruction, to the onset of the response, the behavior. Duration is how long the behavior lasts, frequency is how many times it happens, and IRT is the time between two instances of the same behavior. Measuring how long it takes for someone to start following a direction is measuring latency. Think of it as the lag time between the signal and the action starting. Question 7. What is the purpose of a functional assessment? A. To diagnose a developmental disorder. B. To determine the function or purpose of a behavior. C. To measure how often a behavior occurs. D. To teach the client a new skill. Answer: B. To determine the function or purpose of a behavior. This question is about functional assessment, and the keyword function is a major clue. Functional assessment isn't about diagnosing conditions or just counting behaviors or teaching skills. Its core purpose is to understand why a behavior is happening, what the person gets out of it, the function. Does the behavior help them get attention, escape a task, get access to something tangible, or does it feel good internally, sensory? Understanding the function is crucial for choosing effective intervention strategies. If you know why someone is doing something, you can help them find a better way to get the same result. Question 8. When a behavior is no longer followed by reinforcement and its frequency decreases over time, this process is called A. Punishment, B. Extinction, C. Discrimination, D. Generalization. Answer: B. Extinction. This question describes what happens when a behavior that used to get a reward, reinforcement, no longer gets that reward, causing the behavior to happen less often. This is the definition of extinction. Punishment makes a behavior less likely by adding something unpleasant or taking away something pleasant. Discrimination is learning to respond differently in different situations. Generalization is when a behavior happens in different situations or with different people. If a child used to get candy every time they screamed in the store, reinforcement, and you stop giving candy when they scream, the screaming is likely to decrease through the process of extinction. The behavior dies out because it's no longer being fed by reinforcement. Question 9. Which of the following is not an example of a discriminative stimulus, as DE? A. A red light at an intersection. B. A picture of a dog when teaching animal names. C. A bell ringing indicating class is over. D. A child crying. Answer: D. A child crying. This question asks you to identify which option is not a discriminative stimulus, SDE. And ST is a signal that tells you that reinforcement is available if you perform a specific behavior. A red light signals that stepping on the gas will not be reinforced and might lead to punishment. A picture of a dog is the cue to say dog to get praise. A bell signals that leaving class is okay, reinforced. A child crying. While an antecedent that might occasion a behavior, like a parent picking them up, isn't a signal that reinforcement is specifically available for the child's crying behavior in the same way the others are clear cues for specific actions to gain reinforcement. The crying is the behavior itself, not a signal for a behavior. SEDs are like green lights or signs that tell you now is the time to do X to get Y. Question 10. What is the term for providing a cue or hint to help a client perform a correct response? A. Reinforcement. B. Prompt. C. Consequence. D. Extinction. Answer. B. Prompt. This question is about giving assistance to a learner to help them perform a skill correctly. The phrase providing a cue or hint to help a client perform a correct response describes prompting. Prompts are supports that we use during teaching to make sure the client gives the right answer or does the right action, increasing the likelihood of reinforcement. Reinforcement happens after the behavior. A consequence happens after the behavior. Extinction is stopping reinforcement. When you point to the correct picture after asking, "Where is the dog?" you are providing a prompt. Prompts are like helping hands to guide the learner towards success. Question 11. When documenting client progress, RBTs should be A. Subjective and interpretive. B. Objective and factual. C. Focused only on challenging behaviors. D. Writing opinions about the client's mood. Answer. B. Objective and factual. This question is about proper documentation practices for RBTs. The key idea is how you should describe what happens during a session. Objective and factual means describing only what you can see and hear, without adding your personal feelings, opinions, or interpretations. Subjective means based on feelings. Focusing only on bad behavior isn't a complete picture, and guessing moods isn't objective. Good documentation is like being a camera and a microphone, just recording the observable events and data accurately. You should write down exactly what the client did, what you did, and what happened, using numbers and clear descriptions, not interpretations. Question 12. Which type of data collection involves recording whether a behavior occurred at any point during a specific interval? A. Whole interval recording. B. Partial interval recording. C. Momentary time sampling. D. Frequency recording. Answer. B. Partial interval recording. This question asks about a specific method of data collection using time intervals. The phrase behavior occurred at any point during a specific interval is the definition of partial interval recording. In partial interval recording, you divide the session into small time blocks, intervals, and mark if the behavior happened at all during that interval, even just for a second. Whole interval recording requires the behavior to happen throughout the entire interval. Momentary time sampling means you only check if the behavior is happening exactly at the end of the interval. Frequency is just counting occurrences, not tied to intervals in this way. Partial interval recording is useful for behaviors you want to decrease, as it tends to overestimate how often it's happening. Question 13. What is the primary reason for maintaining professional boundaries with clients and their families? A. To avoid becoming friends with them. B. To ensure effectiveness and ethical practice. C. To limit the amount of time spent with them. D. To make the RBT's job easier. Answer. B. To ensure effectiveness and ethical practice. This question is about the importance of professional boundaries in the RBT role. While avoiding over-friendliness might be a result, the main reason for professional boundaries is to maintain a clear professional relationship that ensures your services are delivered effectively, objectively, and ethically. Crossing boundaries can lead to conflicts of interest, affect your ability to make objective decisions, and potentially exploit or harm the client. It's not about limiting time or making your job easier. It's about keeping the relationship focused on the client's clinical needs and upholding ethical standards. Maintaining professional boundaries protects both you and the client and keeps the therapy focused and safe. Question 14. When teaching a new skill, breaking it down into smaller, manageable steps is called A. Shaping. B. Chaining. C. Discrimination Training. D. Generalization. Answer B. Chaining. This question describes a common teaching strategy where a complex skill is broken down into a series of smaller steps. This process is called chaining. Shaping involves reinforcing closer approximations to a desired behavior, gradually changing the behavior over time. Discrimination training teaches the client to respond differently to different cues. Generalization is when a learned skill happens in new situations. Chaining is like writing a recipe. You list all the individual steps needed to complete the whole task, like washing your hands or getting dressed. You teach one step at a time or prompt through the whole sequence until the client can do it independently. Question 15. If a client engages in a behavior to get attention from others, the function of that behavior is likely A. Escape. B. Tangible. C. Sensory. D. Attention. Answer D. Attention. This question is asking about the function of a behavior, specifically when the behavior is maintained because it results in interaction from others. The clue is to get attention from others. Behaviors often serve one of four main functions: to get attention, social positive; to escape or avoid something unpleasant, social negative; to get access to a tangible item or activity, tangible; or because it feels good or provides automatic stimulation, sensory/automatic. If the behavior results in people looking, talking, or interacting with the client, the function is likely attention. Understanding this helps you figure out why they are doing the behavior, which is key to changing it. Question 16. What is the term for taking data on every single instance of a behavior? A. Event recording. B. Discontinuous measurement. C. Percentage of occurrence. D. Trial-by-trial data. Answer A. Event recording. This question asks about measuring every time a behavior occurs. Every single instance is the key phrase. Event recording, also called frequency counting, is when you count each time the target behavior happens. Discontinuous measurement methods, like interval recording or time sampling, only capture some instances or whether it occurred during a block of time. Percentage of occurrence is a calculation, not a direct measurement method. Trial-by-trial data is used in skill acquisition to track performance on individual teaching attempts, so simply counting every time a behavior happens is called event recording. Think of it like clicking a counter every time you see the behavior occur. Question 17. Which type of graph is most commonly used in ABA to display client behavior data over time? A. Bar graph. B. Pie chart. C. Line graph. D. Scatter plot. Answer C. Line graph. This question asks about the standard graph used in ABA for tracking behavior change. Line graphs are the most common because they clearly show how a behavior changes over time. The x-axis usually represents time, sessions, days, and the y-axis represents the measurement of the behavior, frequency, duration, percentage. This allows you to easily see trends, like if a behavior is increasing or decreasing after an intervention is started. Bar graphs compare different items, pie charts show parts of a whole, and scatter plots show relationships between two variables. For tracking behavior change over time, the line graph is your go-to tool in ABA. Question 18. Providing reinforcement for any behavior, XCPT, the challenging behavior, is an example of A. Differential reinforcement of other behavior. D-row. B. Differential reinforcement of alternative behavior. DRE. C. Differential reinforcement of incompatible behavior. TRI. D. Punishment. Answer A. Differential reinforcement of other behavior. D-row. This question describes a specific type of differential reinforcement procedure. Differential reinforcement means you reinforce one behavior while putting another on extinction, not reinforcing it. DURO stands for differential reinforcement of other behavior. This means you give the client reinforcement if the challenging behavior does not occur for a specific amount of time or at a specific moment. You are reinforcing any behavior other than the target behavior. DRI reinforces an alternative behavior that serves the same function. DRI reinforces a behavior that is impossible to do at the same time as the challenging behavior. Punishment is about making the behavior less likely by adding something negative or removing something positive. With DRO, you reinforce the client for simply not doing the problem behavior during a set period. Question 19. What should you do if a client's challenging behavior occurs that is not addressed in their current behavior intervention plan? A. Implement a punishment procedure you think might work. B. Ignore the behavior completely. C. Contact your supervisor immediately for guidance. D. Ask the parents what they usually do. Answer: C. Contact your supervisor immediately for guidance. This question is about what to do when faced with a challenging behavior that isn't covered in your client's plan. As an RBT, you implement the plan designed by your supervisor. You do not create your own interventions, especially for challenging behaviors. Ignoring it might not be appropriate or safe, and asking parents isn't how clinical decisions are made in ABA. Your ethical and practical responsibility is to inform your supervisor as soon as possible so they can assess the situation. Determine the function of the behavior and modify the plan if necessary. Always go to your supervisor when you encounter something unexpected or outside the plan. Question 20. Which term refers to a decrease in the future frequency of a behavior as a result of a consequence? A. Reinforcement. B. Punishment. C. Extinction. D. Prompt. Answer: B. Punishment. This question asks about the process where a consequence leads to a behavior happening less often in the future. This is the definition of punishment. Reinforcement makes a behavior more likely in the future. Extinction decreases behavior by stopping reinforcement for a previously reinforced behavior. A prompt is a cue given before the behavior to help it occur. The core idea of punishment is that it reduces the future likelihood of the behavior it follows. If touching a hot stove behavior results in pain, consequence, you are less likely to touch it again. That's punishment. Question 21. When teaching a new skill using discrete trial training, DTT, what is the correct order of the trial? A. Consequence, behavior, antecedent. B. Antecedent, consequence, behavior. C. Behavior, antecedent, consequence. D. Antecedent, behavior, consequence. Answer: D. Antecedent, behavior, consequence. This question is about the structure of a single teaching trial in discrete trial training. DTT. DTT breaks down learning into small, structured steps. Each trial follows an ABC sequence. Antecedent, the instruction or cue. Behavior, the client's response. And consequence, what happens immediately after the client's response, like reinforcement for a correct answer or a correction for an incorrect one. This consistent structure helps the client learn clearly what response is expected in response to a specific cue. It's the fundamental building block of a DTT session. Question 22. What is the term for a consequence that involves the removal of a stimulus following a behavior, which increases the future probability of that behavior? A. Positive reinforcement. B. Negative reinforcement. C. Positive punishment. D. Negative punishment. Answer: B. Negative reinforcement. This question describes negative reinforcement. The key phrase is removal of a stimulus following a behavior, which increases the future probability. Removal relates to negative, taking something away, and increases the future probability means it's reinforcement. So, negative reinforcement is when taking something away makes the behavior happen more often in the future. For example, if a child cries when presented with broccoli, behavior, and the parent takes the broccoli away, removal of stimulus, and the child is then more likely to cry when presented with broccoli in the future. That's negative reinforcement. The crying behavior was reinforced by escaping the broccoli. Question 23. Confidentiality means A. Sharing client information only with their family members. B. Keeping client information private and only sharing it with authorized individuals involved in their care. C. Discussing client progress with other RBTs for advice. D. Using client names when discussing cases in public. Answer: B. Keeping client information private and only sharing it with authorized individuals involved in their care. This question is about the ethical principle of confidentiality. Confidentiality means protecting your client's private information. You should only share information with people who are directly authorized to receive it, which typically includes your supervisor and potentially other members of the treatment team who need the information to provide care. You should never discuss client information in public with unauthorized family members or casually with other RBTs who aren't working on that specific case. Maintaining confidentiality is a crucial ethical responsibility to protect the client's privacy and trust. Question 24. When a client performs a skill in different locations, with different people, or using different materials than where it was originally taught, this is called A. Discrimination. B. Shaping. C. Generalization. D. Prompting. Answer: C. Generalization. This question describes generalization, which is a critical goal in ABA therapy. Generalization is when a skill or behavior learned in one specific situation occurs in other different situations as well. This shows that the client truly learned the skill in a functional way, not just in response to very specific cues or environments during teaching. Discrimination is learning to respond differently to different cues. Shaping is reinforcing closer approximations. Prompting is providing help. If a child learns to say dog when shown a picture of their dog, generalization is when they also say dog when they see a different picture of a dog, a real dog outside, or a dog in a book, and they say it to different people. We want skills to generalize so they are useful in everyday life. Question 25. What is the definition of a behavior in ABA? A. Anything a person thinks or feels. B. Something a person says or does that is observable and measurable. C. A personality trait or characteristic. D. A medical diagnosis. Answer: B. Something a person says or does that is observable and measurable. This question asks for the definition of behavior from an ABA perspective. In ABA, we focus on observable and measurable actions or words. Thoughts and feelings are internal and not directly observable by others, so they are not considered behavior in the way we define and measure it. Personality traits and diagnoses are labels, not specific actions. Behavior is what you can see and hear someone do or say. Saying hello is a behavior. Lifting your hand is a behavior. Crying is a behavior. It's the stuff we can count, time, and describe objectively. Question 26. What is the purpose of using reinforcement? A. To decrease a behavior. B. To increase a behavior. C. To ignore a behavior. D. To stop a behavior immediately. Answer: B. To increase a behavior. This question is about the fundamental purpose of reinforcement. The definition of reinforcement is any consequence that follows a behavior and makes that behavior more likely to occur in the future, whether it's positive, adding something goody, or negative, removing something baity. Reinforcement always aims to strengthen and increase the frequency of a behavior. Punishment is used to decrease behavior, and extinction makes it decrease by stopping reinforcement. Reinforcement is about building up desired behaviors. Question 27. Which measurement procedure involves checking if a behavior occurs exactly at a specific moment in time? A. Whole interval recording. B. Partial interval recording. C. Momentary time sampling. D. Frequency recording. Answer: C. Momentary time sampling. This question is about a type of discontinuous measurement using time intervals. The key phrase is checking if a behavior occurs exactly at a specific moment in time. Momentary time sampling is where you set intervals, but you only look up and record whether the behavior is happening right at the end of that interval. Whole interval requires it throughout. Partial interval requires it at any point during the interval. Frequency counts every time. Momentary time sampling is like taking snapshots at specific times to see if the behavior is happening right then. Question 28. What is the first step you should take if you witness a potential ethical violation by another RBT or supervisor? A. Ignore it if it doesn't involve your client. B. Report it immediately to the Behavior Analyst Certification Board, B8B. C. Discuss it with colleagues to see if they agree. D. Talk to the person involved first, if appropriate, or report it to your supervisor. Answer: D. Talk to the person involved first, if appropriate, or report it to your supervisor. This question is about the ethical procedures for reporting concerns. The RBT Ethics Code requires you to address ethical concerns. The first step, if it seems appropriate and safe to do so, is to try to resolve the issue directly with the person involved. However, if it's a serious violation, you are required to report it to your immediate supervisor, or, if that's not possible or appropriate, to the appropriate authority, like the BACB, but not as a first step unless there's no other way. Ignoring it is unethical, and discussing it casually with colleagues is not the correct procedure. Your duty is to ensure ethical practice, starting with addressing the issue professionally, often through your reporting structure. Question 29. When a client is learning to discriminate between two pictures, example, touch apple vs. touch banana, what are you teaching them? A. Generalization. B. Shaping. C. Discrimination. D. Prompting. Answer: C. Discrimination. This question describes discrimination training. The word discriminate means learning to tell the difference between things and respond differently to them. When you teach a client to touch apple when you say apple and show a picture of an apple, but not when you say banana, you are teaching them to discriminate between the Q apple and the Q banana, and the picture of an apple versus the picture of a banana. Generalization is responding the same way to similar things. Shaping is changing the form of a behavior. Prompting is giving help. Discrimination training helps the learner respond correctly to the specific cues associated with reinforcement. Question 30. Which of the following is an example of discontinuous measurement? A. Counting every time a client says, please. B. Timing how long a client engages in tantrum behavior. C. Marking if a client smiled at any point during a 1-minute interval. D. Measuring the time between bites of food. Answer: C. Marking if a client smiled at any point during a 1-minute interval. This question asks you to identify an example of discontinuous measurement. Discontinuous measurement methods, like interval recording or time sampling, do not record every single instance of a behavior or its exact duration or latency. They capture some aspect of the behavior's occurrence within or at the end of an interval. Counting every time, please, is frequency/event recording. Continuous. Timing tantrum duration is continuous measurement. Measuring time between bites is IRT. Continuous measurement. Marking if a behavior happened at any point during an interval, partial interval recording, is a classic example of discontinuous measurement because you aren't recording every single instance or the full duration within that interval. You're just making a mark for the interval itself. Question 31. What should you do if you feel overwhelmed or unsure about how to implement a specific part of a client's behavior plan? A. Try your best and figure it out as you go. B. Ask the client or their parents for help. C. Contact your supervisor for clarification and support. D. Skip that part of the plan. Answer: C. Contact your supervisor for clarification and support. This question is about your responsibility as an RBT when you are unsure about your job duties or the plan. Your supervisor is there to guide and support you. If you are unsure about how to do something in the plan, it is crucial to ask your supervisor for clarification before you try to implement it incorrectly or skip it. Trying to figure it out on your own could lead to ineffective or even harmful intervention. Asking the client or parents is not appropriate, as you are the one providing the service. Your supervisor is your key resource for guidance and support in your role. Question 32. A consequence that involves the presentation of a stimulus following a behavior, which increases the future probability of that behavior, is called A. Positive reinforcement. B. Negative reinforcement. C. Positive punishment. D. Negative punishment. Answer: A. Positive reinforcement. This question describes positive reinforcement. The key phrase is presentation of a stimulus following a behavior, which increases the future probability. Presentation, or adding something relates to positive and increases the future probability, means it's reinforcement. So, positive reinforcement is when you add something desirable after a behavior, and that makes the behavior more likely to happen again. For example, giving a child a cookie, adding stimulus after they ask nicely, behavior, and they are then more likely to ask nicely in the future, is positive reinforcement. You added something good, and the behavior increased. Question 33. What is the purpose of a skill acquisition plan? A. To reduce challenging behaviors. B. To teach the client new skills and behaviors. C. To determine the function of a behavior. D. To collect data on behaviors. Answer: B. To teach the client new skills and behaviors. This question asks about the purpose of a skill acquisition plan. These plans are specifically designed to outline how to teach a client a new skill, whether it's communication, social skills, daily living skills, or academic skills. Behavior reduction plans focus on decreasing challenging behaviors. Functional assessments figure out why a behavior is happening. Data collection is a part of implementing plans, but the plan itself is about what and how to teach. Skill acquisition plans are your roadmap for helping the client learn new things they don't already know how to do. Question 34. When using shaping, you are reinforcing. A. Only the final target behavior. B. Any behavior that occurs. C. Successive approximations of the target behavior. D. Behaviors that are incompatible with the target behavior. Answer: C. Successive approximations of the target behavior. This question is about the technique of shaping. Shaping is used to teach a new behavior by reinforcing behaviors that are progressively closer and closer to the desired final behavior. You start by reinforcing an easy behavior that is somewhat like the target behavior, and then you gradually require the behavior to be more and more like the final goal to earn reinforcement. You aren't just waiting for the final behavior, which might never happen without shaping, reinforcing everything randomly, or reinforcing incompatible behaviors. Shaping is like helping someone climb a ladder, reinforcing them for reaching each rung higher until they get to the top. You reinforce successive approximations. Question 35. Maintaining the privacy and security of client information is guided by which law? A. IDEA. B. ADA. C. AIPA. D. FAPE. Answer: C. AIPA. This question asks about the specific U.S. law that protects the privacy and security of health information, including client information in ABA services, AIBA. Health Insurance Portability and Accountability Act sets the standards for protecting sensitive patient data. IDEA is about special education. ADA is about disability rights, and FAPE. Free appropriate public education is a concept from IDEA. HIPAA is the law that requires you to keep client records and information confidential and secure. Remember HIPAA when you think about keeping client information private. Question 36. What is stimulus control? A. When a behavior happens only in the presence of a specific stimulus. B. When a consequence makes a behavior more likely. C. When a prompt is used to evoke a behavior. D. When a behavior is put on extinction. Answer: A. When a behavior happens only in the presence of a specific stimulus. This question is about stimulus control. Stimulus control occurs when a behavior is more likely to happen when a specific stimulus, an est or discriminative stimulus, is present than when it is absent. The stimulus has gained control over the behavior because the behavior has been reinforced in its presence in the past. For example, if pressing the on button behavior only works when the TV is plugged in, stimulus, then the TV being plugged in has stimulus control over the button pressing behavior. The behavior is under the control of that specific stimulus or cue. Question 37. If a supervisor asks you to do something you believe is unethical, your first step should be: A. Do what the supervisor asks to avoid conflict. B. Refuse to do it and report them to the BACB immediately. C. Discuss your concerns with your supervisor and seek clarification. D. Ask another RBT if they think it's okay. Answer: C. Discuss your concerns with your supervisor and seek clarification. This question is about navigating potential ethical conflicts with your supervisor. Your ethical responsibility requires you to raise concerns. The RBT ethics code directs you to first discuss your concerns with the person involved, which in this case is your supervisor. You should calmly and professionally explain why you believe the request might be unethical and ask for clarification or alternative instructions. If the issue is not resolved after discussing it, you would then follow your company's reporting procedures or consult with other resources, potentially including the BACB, depending on the severity and outcome of the discussion. But the initial step is always communication with the person who made the request. Question 38. What is the purpose of taking baseline data? A. To show the client's progress after intervention. B. To determine the function of a behavior. C. To measure the behavior before any intervention is started. D. To teach the client how to perform the target behavior. Answer: C. To measure the behavior before any intervention is started. This question is about baseline data. Baseline data is the information you collect about a behavior before you start implementing an intervention plan. It gives you a starting point to compare against once the intervention begins. This allows you to see if your intervention is actually having an effect on the behavior, either increasing a skill or decreasing a challenging behavior. It's like taking a before picture so you can see the changes later. You aren't teaching during baseline, determining function, though baseline data can help inform it, or showing progress that comes after. It's simply measuring the behavior in its natural state before treatment. Question 39. Which of the following is not an example of a prompt? A. Hand-over-hand assistance. B. Saying the first sound of a word. C. Giving a high five after a correct response. D. Pointing to the correct picture. Answer: C. Giving a high five after a correct response. This question asks you to identify what is not a prompt. A prompt is a cue or hint given before or during a behavior to help the client perform it correctly. Hand over hand, saying the first sound, vocal prompt, and pointing, gesture prompt are all ways to guide the client towards the correct response. Giving a high five happens after the correct response. It's a consequence, specifically a form of social reinforcement. Prompts help the behavior happen. Reinforcement happens because the behavior happened correctly. Question 40. When reporting hours to your supervisor, you should only report: A. All hours you spent thinking about the client. B. Only the hours you spent directly with the client. C. All hours you worked, including breaks and administrative tasks. D. Hours worked that were supervised and involved billable client activities. Answer: D. Hours worked that were supervised and involved billable client activities. This question is about accurate reporting of your work hours, which is an ethical requirement. You should only report hours where you were working directly on client programming under supervision or completing tasks specifically assigned by your supervisor related to the client that are considered billable activities by your company. You do not bill for thinking time, breaks, or general administrative tasks not tied to a specific client program. It's crucial for ethical billing and for accurate documentation of supervised hours that you only report time spent actively providing services or completing assigned tasks related to the client's program under supervision. Question 41. What is the term for a procedure where reinforcement is provided for a behavior that cannot occur at the same time as the challenging behavior? A. Differential reinforcement of other behavior. DRO. B. Differential reinforcement of alternative behavior. DRE. C. Differential reinforcement of incompatible behavior. DRI. D. Punishment. Answer. C. Differential reinforcement of incompatible behavior. DRI. This question describes differential reinforcement of incompatible behavior. DRI is a specific type of differential reinforcement where you reinforce a behavior that makes it physically impossible for the client to do the challenging behavior at the same time. For example, if the challenging behavior is standing up during circle time, you might reinforce sitting quietly because you can't do both at once. DRO reinforces any behavior other than the target behavior, and DRA reinforces an alternative behavior, which might or might not be incompatible. DRI is specifically about finding a behavior that physically prevents the problem behavior from happening simultaneously. Question 42. When implementing an extinction procedure, you should expect to see A. The behavior increase initially before it decreases. B. The behavior decrease immediately. C. The behavior stop happening completely right away. D. The behavior never happen again. Answer. A. The behavior increase initially before it decreases. This question is about the extinction burst, which is a common and expected phenomenon when you first implement extinction. When a behavior that used to get a reward suddenly stops getting it, the individual often tries harder or does the behavior more intensely for a short period before it starts to decrease. Think about a button that used to give you candy. If it stops working, you'll probably press it more furiously for a bit before giving up. This temporary increase is called an extinction burst, and it's usually a sign that the procedure is working as expected, not failing. Question 43. What is the role of the RBT in the service delivery system? A. Designing and modifying treatment plans. B. Conducting assessments and writing reports. C. Directly implementing treatment plans developed by a supervisor. D. Providing clinical supervision to other staff. Answer. C. Directly implementing treatment plans developed by a supervisor. This question circles back to the core role of the RBT, similar to question 1, but phrased differently. It asks about the RBT's place in the overall system of providing ABA services. The RBT's job is on the front lines, carrying out the strategies and plans created by the supervisor. They don't design the plans, conduct complex assessments, write clinical reports, or supervise others. Your role is critical because you are the one directly working with the client, delivering the intervention as planned and collecting data. You are the implementer of the treatment developed by the behavior analyst. Question 44. When teaching a client to wash their hands, you might break the task down into steps like turn on water, wet hands, get soap, rub hands, rinse hands, turn off water, dry hands. This is an example of A. Discrimination training. B. Generalization. C. Task analysis. D. Shaping. Answer. C. Task analysis. This question describes task analysis. Task analysis is the process of breaking down a complex skill or behavior into a sequence of smaller, easy-to-manage steps. The list provided, turn on water, wet hands, etc., is the result of a task analysis for hand washing. You do a task analysis before you use a chaining procedure to teach the steps. Discrimination training teaches different responses to different stimuli. Generalization is performing the skill in new contexts. Shaping is reinforcing successive approximations of a single behavior. Task analysis is about breaking a multi-step task into its individual components. Question 45. What does AIPAA stand for? A. Health Information Privacy and Accessibility Act. B. Health Insurance Portability and Accountability Act. C. Healthcare Individuals Protection and Access Act. D. Human Interaction Privacy and Application Act. Answer: B. Health Insurance Portability and Accountability Act. This question is a straightforward definition check for the law that protects client information. AIPAA stands for the Health Insurance Portability and Accountability Act. This law is fundamental to protecting client confidentiality and security in healthcare settings, including ABA services. Knowing what the acronym stands for helps reinforce its importance in keeping client information safe and private. It's a key part of ethical practice. Question 46. Which of the following is an example of positive punishment? A. Taking away a toy because a child hit their sibling, leading to less hitting in the future. B. Giving a child extra chores because they didn't clean their room, leading to more room cleaning in the future. C. Presenting an unpleasant sound contingent on a behavior, leading to a decrease in that behavior. D. Allowing a child to escape a difficult task by engaging in a challenging behavior, leading to an increase in that behavior. Answer: C. Presenting an unpleasant sound contingent on a behavior, leading to a decrease in that behavior. This question asks for an example of positive punishment. Positive punishment means you add something unpleasant after a behavior, which results in the behavior happening less often in the future. Option A is negative punishment. Taking something away results in decrease. Option B describes adding chores, but it says it leads to more cleaning, so it's unclear if it's punishment. Punishment decreases behavior, and sounds more like potential negative reinforcement, cleaning to avoid chores. Option D describes escaping a task, which increases the behavior, negative reinforcement. Option C describes adding an unpleasant sound, which fits the presentation of a stimulus part of positive punishment, and states it leads to a decrease in that behavior, fulfilling the definition of punishment. Question 47. When using a most to least prompting strategy, you start with A. The least amount of help needed. B. The prompt that provides the most assistance. C. Independent responding. D. Error correction procedures. Answer: B. The prompt that provides the most assistance. This question is about prompting strategies, specifically most to least. This strategy starts with the most intrusive or helpful prompt possible, like hand-over-hand or full physical guidance, and gradually fades to less intrusive prompts as the client learns. The idea is to ensure the client responds correctly initially with maximum support, and then systematically remove that support. Least to most prompting is the opposite. Starting with the most help ensures success early on. Question 48. Which ethical principle involves being truthful and honest? A. Beneficence. B. Fidelity. C. Autonomy. D. Justice. Answer: B. Fidelity. This question is about ethical principles, focusing on honesty and trustworthiness. Fidelity means being reliable, truthful, and keeping promises. Beneficence is doing good, autonomy is promoting independence, and justice relates to fairness. In your role as an RBT, fidelity means being honest in your data collection, reporting, and all interactions with clients, families, and supervisors. It's about being trustworthy in all aspects of your work. Question 49. What is the primary purpose of collecting data on client behavior? A. To fill out paperwork for the agency. B. To prove that the RBT is doing their job. C. To make informed decisions about the client's progress and treatment plan. D. To compare the client to other individuals. Answer: C. To make informed decisions about the client's progress and treatment plan. This question asks about the main reason we meticulously collect data in ABA. While data does go on paperwork and shows that sessions occurred, the most important reason is clinical. The data tells us if the interventions are working. Is the skill increasing? Is the challenging behavior decreasing? The supervisor uses this objective information to decide if the plan needs to be continued, modified, or changed entirely. Data is the critical tool that guides all clinical decisions in ABA. It's not about comparison or just filling forms. It's about using evidence to help the client progress effectively. Question 50. If a client frequently engages in a behavior because it feels good to them physically, like hand flapping or rocking, the function is likely A. Escape. B. Attention. C. Tangible. D. Automatic/sensory. Answer D. Automatic/sensory. This question is about identifying the function of a behavior when it is maintained by the internal sensation it produces for the individual. Behaviors that feel good or provide some form of internal stimulation, like rocking, hand flapping, or repeating certain sounds, are often serving an automatic or sensory function. They don't require another person or external consequence. The reinforcement comes from the behavior itself. Escape is about getting away from something unpleasant. Attention is getting reaction from others. Tangible is getting an item or activity. Behaviors that are reinforcing because of how they feel internally are often serving an automatic or sensory function.